Hi, I'm Dr. Rick Duplantis, and welcome to my show called It's Your Health. The show is designed to empower you with information and knowledge to make the proper decision when it comes to your health. So, hope that you're learning a few things from the show. Hope that you're viewing the show on a weekly basis. It is replayed. Our premiere night is at 8 p.m. on Monday night, but it's replayed again 8 p.m. on Friday night and played during the week. You know anyone out there that, that has really accomplished a great deal when it comes to health and fitness? You know someone who has lost a great deal of weight, or if I'm talking to that person, if you've lost a great deal of weight, and you want to come on the show and share your story to inspire others, we would love to have you on. Please drop me a note, drop me an email, tell me a little bit about your walk and your journey in health and improving your health overall and your weight loss program, and have you share that with our viewing audience, and for inspiration for other people to really be motivated to embark on a program of improving their health through weight loss. My topic tonight is going to be on gout, and gout is the condition of, one of my technical advisors says it's the rich man's disease, and so we'll go through the topic, and I think you'll learn quite a bit about this condition. It mostly affects men, wakes you up in the middle of the night, might have a great deal of pain, severe pain that wakes you up in the middle of the night. Usually it's in the foot, the toe, more specifically. And then when it happens, it's called podagra, and that's the general term that's used to describe gout when it affects the toe, but it can affect the ankle, and sometimes also, the knee, and also I've seen gout in the hands and actually in the elbow as well. So it's not limited to the foot or the big toe, or the great toe as we call it, but when it does, it's called podagra, but it is also associated with the production of these gout, these crystals that form in other joints in the body. So here we go to that information now. Understanding gout, well, the underlying cause of gout is an excessive uric acid buildup in the blood. Uric acid is produced during the metabolism of purines, a breakdown product found in high amounts in certain foods and beverages such as meat. I want to say more specifically, red meat. It's even found in poultry and seafood and alcohol, of course, which we enjoy a great deal here in South Louisiana. There are two ways to get these compounds, these purines. One is from the diet, and the other is from making it in the body. Now, purines are important for the sense of nucleic acid. These are the building blocks of our DNA, which is the structure that tells our body what to do, the blueprint of our bodies, more or less. However, your body doesn't need dietary purines. It can produce them on its own. So just about all dietary purines are converted to what we call uric acid. Hyperuricemia is a term of excessive uric acid in the body. Hyperuricemia results either from an excess production, as we just mentioned, that the body does produce uric acid, or not enough excretion of uric acid, causing this uric acid to build up in the blood, or a combination of both. The undersecretion is the primary cause of hyperuricemia in about 90% of cases, so that the kidneys are not getting rid of this uric acid properly, adequately, thus causing a buildup of this uric acid in the blood. Where someone with the overproduction of uric acid is less than 10%. However, high blood levels of uric acid don't necessarily mean you'll develop gout. It only increases the risk based upon varying degrees of the excessive uric acid levels, hyperuricemia we call it. When blood levels are between 7 and 8 milligrams per deciliter, the risk of gout is less than 1% per year. But when these uric acid levels are greater than 9 milligrams per deciliter and become higher, the risk of developing gout is 6 times higher. Now, to understand gout, all of this is why the mainstay of gout treatment is preventing excessive acid production, or this excessive uric acid, I might say, be more specific, the hyperuricemia. Unfortunately, for a lot of us, this can be tough, as gender, menopause, and genetics play a role in developing gout. Men and postmenopausal women produce the most uric acid. So gout is not a male-only condition. Females get it as well. If you fall into one of the above groups, you might consider taking preventative measures. Research has shown that this hyperuricemia, this high uric acid level, is a genetic trait. So if your grandfather had the gout, chances are that you may get the gout as well. Genetic studies have demonstrated a high degree of similarity of high uric acid between pairs of twins, 53% for identical twins and 24% for fraternal twins. But there is good news for those who are at increased risk for developing gout. All of the studies indicate that environmental factors substantially influence whether or not a predisposition for hyperuricemia will actually result in gout. Or simply put, lifestyle is a driving force behind the development of excessive uric acid and gout. Here are a few lifestyle tips in preventing excessive uric acid. Avoiding excess alcohol. Drinking too much alcohol can interfere with the removal of the uric acid from the body. Remember, excretion is the primary way that uric acid builds up. So when you consume great quantities of alcohol, you decrease the ability of the body to excrete this uric acid, and thus you have the buildup causing the problems. You want to limit your dietary purines. This is from the red meats, the pork, the lamb, and seafood. All these things we enjoy here in South Louisiana, especially the seafood, and we're in crawfish season now with all the spices and all those great foods we love. So, and you can't have crawfish without beer. So, if you have genetic predisposition to gout, you might want to be careful, maybe not have the beer. You want to maintain a healthy weight. People that are obese, they're at a greater risk for gout as well. One theory is that excess body weight causes a rapid turnover in body tissues, increasing the need for these purines and these nucleic acids. The end result is more uric acid production. Optimize kidney function and health. Since underexcretion causes 90% of the excessive uric acid in the body, improving and maintaining kidney function is important. So, and one of the technicians said, well, I drink a lot of water, and that keeps me from getting the gout. Although I like to drink, alcohol from time to time and eat spicy food. Well, when you drink a great deal of water, then this increases your kidney function. Thus, the kidney's ability to excrete the uric acid, so you don't end up with that buildup. Also, optimizing the thyroid function. Hypothyroidism, or low thyroid function, in other words, is associated with gout. The optimized blood pressure. Now, how many people think of hypertension as a cause of gout? Hypertension is associated with gout. This can cause problems. Chronic exposure has been linked to some cases of gout, chronic hypertension. Minimize your use of prescription diuretics. Medications that increase urine flow are associated with gout. You're talking about your diuretics, your hydrochlorothiazides. Talk to your doctor if you're at an increased risk of gout and discuss your alternatives for treating your high blood pressure. Remember, folks, the expert in high blood pressure is the kidney specialist, a nephrologist. He is your go-to person for uncontrolled hypertension or high blood pressure, as you know it. Treat sleep apnea. Here's another study that many people do not realize, that there's a recent study in arthritis and rheumatology has found that sleep apnea puts one at increased risk for development of gout. Now, how does gout increase my risk of heart disease? Well, gout is bad for your heart, believe it or not. How does something that causes pain in your big toe present as a cardiovascular risk factor? It's bad for your heart because it's associated with diabetes, obesity, which are two independent risk factors for heart disease. So gout is tied in with your diabetes and your excessive weight, your obesity. So many reasons to get healthy, so many reasons to decrease your body weight, these are two independent risk factors, as I say, for heart disease. The odds of developing gout are 4 times as high for diabetics than non-diabetics. However, in the last few years, reports indicate that the underlying cause of gout, excessive uric acid, we call hyperuricemia, may in fact be an independent risk factor of cardiovascular disease. Who would have thought gout leads to cardiovascular disease? You know, it's a likely culprit in chronic inflammation. Gout would be uric acid crystalline structures appear to activate the immune system and trigger a robust inflammatory reaction. You know, this is why people wake up in the middle of the night with extreme pain. You know, detailed analysis of uric acid's role in initiating inflammation reveals it's a very complex and powerful interaction between the uric acid crystals, the immune cells, our white blood cells that fight infection, and the multiple chemical signals in the eventual production of a very powerful pro-inflammatory protein we call interleukin-1 beta. You know, these are produced by our white blood cells, you know, lymphocytes, monocytes. Once released into circulation, this pro-inflammatory, we'll call it, the big name for it is cytokine, this compound called interleukin-1 beta, signals the activation of more immune cells and inflammatory proteins, resulting in a destructive inflammatory response. So the initial instance of the gout, these cells start spewing out this interleukin-1 beta, these pro-inflammatory proteins, and as a result, other blood cells are brought to the area and also continue the process of spewing out, producing these interleukin-1 beta compounds we call cytokines. And these cause inflammation, and gives rise to the pain. Chronically elevated inflammation can damage cells and tissues throughout the body, making it the common denominator of age-related disorders, including heart disease. You know, heart disease and cancer are pro-inflammatory conditions and diseases. Think about it. Why is gout painful? You know, we just talked about the inflammatory process here. Gout's painful because these needle-like crystals of uric acid are piercing joint tissues. And if you ever looked at one, if you look up on the internet for, you know, gout crystals, you're going to see just a very wicked-looking crystal with all these projections off of it, and these like thousands of little needles, and it causes a great deal of pain, discomfort. And if it weren't enough, the crystals also initiate a powerful inflammatory response that causes redness, swelling, and heat. So if you've ever had the gout, you know what I'm talking about, the redness of the toe, the warmth to the touch, and of course the extreme pain and swelling. This occurs within tight joint spaces with little ability to expand and relieve pressure. Thus we talked about the big toe being the main joint in the body that gout attacks, but it can go to other joints as well. You know, it's also painful that a 2010 Gout Attitudes Patient Survey reported 37% of the people with the disease would trade a winning lottery ticket for the insurance never to suffer another flare-up of gout. Now that's pretty strong. That tells you a little bit how severe, how painful a gout episode is. The survey developed by Men's Health Network and Takeda Pharmaceuticals, that they found that 23% compare of pain to shattered glass piercing the skin, 28% to a break in a bone, and 34% compare the pain of gout to a severe sunburn, and 37% to a severe stubbed toe. 69% described the pain as an attack as miserable. 73% reported limited physical activity when they had an attack of gout. 27% of gout patients say that disease caused them to take time off from work. 43% had canceled social plans because of a gout attack. 36% said they would leave their homes more often if they did not have gout. Didn't really understand or realize here that gout is the cause of people staying home and not getting out. This is why people suffering with acute gout are willing to ingest a large quantity of prescription and over-the-counter pain medications, but the possibility for severe side effects has some patients searching for safer ways to control the pain. Cherries can help. Several studies provide strong evidence that the anthocyanins from cherries relieve pain and reduce inflammation. An animal study conducted at Johns Hopkins Hospital found that tart cherry extract provided the relief from painful inflammation comparable to non-steroidal anti-inflammatories. I'm sure this is something you didn't know. The Korean Angelica is another alternative to side effect prone pain medication used in traditional herbal medicines as a pain reliever. Korean analgesics fight pain through its effects on the brain. This makes it useful for many types of pain, including the painful inflammation characterizing gout. Curcumin and boswellia are traditional alternatives simply because they are so effective in inhibiting the powerful inflammatory pathways that are activated during acute gout. You know, how do you diagnose gout? Classically, hyperuricemia, which is high uric acid level, and podagra, as we said, is a swollen red big toe, are enough to make the diagnosis of gout. However, clinicians, your doctor, will tell you that gout doesn't only affect the toe, the big toe, it can occur in any joints, as I mentioned previously. You know, so levels of hyperuricemia, the uric acid level greater than 8.6 milligrams per deciliter in men, and an elevation of above 7.1 milligrams per deciliter in women, and severe pain in at least one joint as the criteria for most physicians to call it gout. But keep in mind that gout occurs without high uric acid levels, and many people with raised uric acid levels may never ever develop gout in itself. In cases with normal uric acid levels, the fluid around the joints we call synovial fluid should be analyzed and should be considered when diagnosing gout. Although some doctors might treat gout without one, the presence of large needle-shaped crystals within the joint fluid confirms the diagnosis and can be used to differentiate gout from pseudogout or septic arthritis. So, you know, they go in and do an orthocentesis, a procedure where a needle is placed into the joint, it's aspirated, they withdraw the fluid in the joint, and it's analyzed for the gouty tophi, the crystals of gout. By the way, outside of ruling out a fracture, you probably can forego the x-ray if your doctor orders one. It won't help to diagnose acute gout and should only be used to evaluate bone and joint erosion of chronic gout. So x-rays are really ineffective. If you already have high uric acid levels during an acute attack, how can you bring your level down without using a prescription drug? Well, during an acute attack of gout, lowering uric acid isn't beneficial, obviously, and maybe surprisingly to some. Instead, focus on quickly reducing the inflammation. Start by icing and resting the affected joint. Talk with your doctor about conventional medications such as non-steroidal anti-inflammatory drugs, NSAIDs, colchicine, glucocorticoids, and biologic agents that inhibit the interleukin-1 beta. They might be appropriate for you, but they also have the potential for some side effects. Check with your doctor. You know, although not as an effective in reducing inflammation from gout individually, natural extracts, when taken together, can be safe and effective in reducing acute inflammation. However, the quick progression and resolution of acute gout may make it, you know, maybe less amenable to these nutrient interventions. You want relief from gout, you want it now. When you take the nutrient type supplements, your gout resolution may be prolonged as a result. And I don't think anybody wants to prolong the agony of gout. You know, there are specific nutrients that target joint inflammation and inflammatory signals, including the interleukin-1 beta that causes all the swelling, the redness in gout produced by the immune system, our white blood cells. Taking them together at a slightly higher than normal dose for a short duration may produce wanted results. Curcumin, for example, omega-3 fatty acids, resveratrol, the compound in red wine. These may be suited for this purpose, but like I mentioned, it won't be quick and rapid as a medication. You know, if you have chronically elevated uric acid, you know, if you haven't had gout, you know, what are the choices for reducing uric acid naturally? The immediate natural thing to do is change your diet. If you have high uric acid levels and have many attacks of gout, you want to limit your red meat intake, eat more vegetables, protein, drink more water. As one of our technical advisors says, he drinks a lot of water. That's why he does not have the gout, although he eats spicy foods. You know, you also want to reduce your alcohol intake and eliminate sugar-sweetened drinks from your diet as well. All of this will help to lower dietary purines that are involved in the excessive uric acid productions. Once dietary changes are in effect, your next choice should be an extract from the fruit, you know, Terminalia belvicea. You know, many compounds out there, and this was used in the Indian medicine many years. You know, gout is a very serious problem. When you have it, you want to be out of pain. You know, obviously I've touched on these things for you, and you know, prevention is everything. So, you know, hydration increases the function of the kidney, which is very good for you. I would definitely advise you to, you know, hydrate and increase your kidney function as well, but also decrease your ability to have these gout attacks. You know, it's a preventative measure you can do. Back off on the real spicy food, the red meat, eat in moderation, alcohol as well, just drink in moderation as well. As we listed, those are the top causes of high uric acid levels in the blood and the under-excretion by the kidneys of uric acid. You know, you can improve that by drinking more water, because when we drink water, when we hydrate, we increase and step up the function of the kidney and its ability to excrete toxins, its ability to get rid of this uric acid. I hope you've gained some insights to gout. It plagues many, many men, but you know, it also occurs in postmenopausal women as well. And I hope that these help you out. I'm Dr. Rick Duplantis. I hope you tune in future episodes of this show called It's Your Health. We're in our second year of production now. I hope you'll continue watching. I want to wish you a very pleasant good evening. I'm Dr. Rick Duplantis. Good night, and God bless you.